Zepbound news, covering Zepbound through Medicare and covering WeGovy through Medicare. Hey, beautiful friends, I'm Elizabeth, Countess of Shopping. If we haven't met, I've been on GLP-1 medication the last 22 months, losing 98 pounds, almost 100 pounds in the last 22 months. And on today's episode, I want to talk about, I'm a GLP-1 enthusiast, and I want to talk about the cost of covering GLP-1 medications for chronic obesity management through Medicare and the cost of what that is, and will this get approved in there? As of right now, there's a law that's prohibiting chronic obesity management injections like Zepbound and Wegovy to be covered by Medicare. And so hopefully that law will change. There's a lot of lobbying going on to make that change. We shall see. But there is an article, I will cite my source as I do with all my sources, linked down below from CNBC that came out that was published on October 15th, 2024 by Annika Kim Costanello and Ashley Kaput. And they're talking in this article about it will cost Medicare to cover these drugs in the US $35 billion through 2034. So to get really specific on that, it was allowing Medicare to cover obesity medications would increase the US federal spending from about 35 billion from 2026 to 2034 in an overall analysis released by the US congressional budget last week. The federal cost for covering these drugs would grow from $1.6 billion in 2026 to $7.1 billion in 2034, said the CBO, the Congressional Budget Office. Full stop before I go into this article even further. It annoys the dickens out of me, as an economist daughter, of that is the cost, but can we talk about the cost benefit analysis of the savings of what it would have to not have I almost just said a cuss word and I'm not going to say that, a tremendous amount of people being chronically, having chronic obesity management without treatment, morbidly obese. Can we talk about the savings on that? About how it's literally helping dropping heart attacks, people dying, major things going on as a result of this. But let me get back to the article from the Congressional Budget Office. The analysis is all hypothetical and comes from drug makers and advocacy groups for the push for the government to expand the coverage of or give more seniors access to the highly popular treatments of those included of Novo Nordisk Wegovy and Eli Lilly's Zepbound, which both carry hefty price tags. They're about a G a month, about $1,000 per month before insurance and other savings card and rebates. Right now, Medicare does not cover weight loss treatments unless they're approved and prescribed for other health conditions. For example, Medicare covers Wegovy for reducing the risk of serious cardiovascular complications in those with heart disease and obesity, but doesn't cover the drug used for weight loss. And I need to add in there, because that is a little bit of a media bias, that I'm just going to make a correction with my red pen on there for CNBC, as who's my source. It's chronic obesity management. This is not for weight loss. Using that term can also imply that there's a vanity component or like trying to get ready for swimsuit season. No, chronic obesity management is actually a disease. I know some people will fight against that. We're not going to fight against that. It actually is a disease. And so it's not for like weight loss, meaning like let's fit into our swimsuit for summertime, like hot girl summer, like this is save my life summer and the rest of the summers of my life with chronic obesity management. But I digress. Let's keep going. The CBO, the Congressional Budget Office, expects that savings from improved health among patients, mainly by reducing the incentives of obesity-related conditions, will grow over time. Still, it says those savings could be relatively small, totaling less than 50 million in 2026 and about 1 billion in 2034. Now, if you go back over, remember they said in 2026, if Medicare started covering these GLP-1 medications, it would cost, it would grow from $1.6 billion in 2026 for our US budget for Medicare covering it, and it would only save $50 million. Nancy, if you're the one that has been calculating these accounting things, I would like you to re-pull out your number 2 sharpened pencil and reevaluate that, because I do not believe it is only a savings of $50 million for coverage for Medicare. That is the Countess of Shopping opinions. That is not in the CNBC article that I am referring to. Like, that just makes me, does that make anyone else, tell me in the comments, does that make anyone else nutso? I don't agree with that. I do not think that it's only a savings of $50 million. I want to be like, can you please interview me, Countess of Shopping? If you know somebody who is in the media, please tell the publisher about me and send them my videos, please. I would love to get on there as an expert, and I'm not an expert. I'm a GLP-1 enthusiast. I would never refer to myself as an expert. But as somebody who's actively my experience, strength, and hope the last 22 months with a large community of thousands of people, I'm going to say, hearing all of y'all's experience, strength, and hope in addition to my own, it is more than $50 million of savings. And also, I know we can't put a price tag on our other non-scale victories, like the price point of being able to, for seniors, be able to live to see your grandchildren and play with them. And there's way other budgetary things too, in addition to that. But I want to say that I think it's substantially more than the $50 million in 2026 of savings that would come from paying for GLP-1 medication for Medicare. Take a breath, Elizabeth. I will. Okay. Even though the net federal savings per users are projected to be larger over the long term, they would still be less than the cost of medications, says the Congressional Budget Office. I'm shaking my shoulders because I am trying not to be so enraged by this. I just don't agree with that at all. I should probably keep my mouth closed and not go down this rabbit hole at all, but it really bothers me. Here's why, though. Let me give some grace to the CBO. Here's why. It expects generic versions of the popular weight loss injections, and quit calling it weight loss injections, CNBC. It's chronic obesity management treatments. This is a treatment plan for a disease, not weight loss injections. Again, that's tainting, like, semantics matter and the way that they're presenting this information, CNBC, but I digress. The CBO also anticipates average net prices for obesity medications will fall in 2027 due to Medicare drug price negotiations with manufacturers. And that the generic versions, that's the point I was trying to make. For chronic obesity management, I'm filling that in with my red pen for CNBC, even though they said weight loss injections, will enter the market with the generic and reduced prices with the generic versions. Semaglutide, the active ingredient in WeGovy, and type 2 diabetes Ozempic could be among the 15 prescription drugs selected for the next round of price talks, which would begin in 2025 and go into effect in 2027. So I'm filming this in October 2024. Knowing we have this going down the pipeline, so many seniors, and share this video with all of your senior friends. I know some people don't like I talk very quickly, so you can slow me down too if you want to share it with your bestie. Be like, just hit her down. You can hit the wheel button that looks like a settings button, and you can slow my speech down because I know I get very fast talking, and that drives some people crazy. Share this video with your bestie though, if they are on Medicare or going to be on Medicare, because Medicare covers these medications. More than 12.5 million beneficiaries would newly qualify for weight loss drugs, for chronic obesity management treatments beginning in 2026, according to the CBO. The analysis said around 2% of those patients are expected to use treatments in the first year. More than 2/3 of Medicare beneficiaries are classified as either obese or overweight, according to their BMI, the CBO says. You mean to tell me that more than 60% of people who are on Medicare qualify for this disease to help them with this disease and a ton of other diseases that come from this disease, chronic obesity management treatment, but we're not willing to cover it for seniors who have paid into Medicare? He's paid into these systems their whole lives. This blows my bonker doodles. It blows my bonker doodles. And you guys know I love, well, I won't say what I love. God bless. Let me keep going. Notably, spending could look significantly different beyond 2034. The CBO says Medicare spending on weight loss drugs, chronic obesity management treatment, would probably be lower on a per user basis due to the lower cost tied with drugs and increased savings. But Medicare coverage of those treatments would still increase net federal costs from 2034 to 2044, the CBO noted. I don't agree with these things at all, but let me keep going. Novo Nordisk, they're the manufacturer of WeGovy and Ozempic. Spokesperson said in a statement on Tuesday, when this was written back in October 15th, 2024, said that medical and societal costs of obesity are significant, and some estimates exceeding $1.7 trillion annually in the US. That is what I've said. Like, what is CBO calculating with? An abacus? Like, are you kidding me right now? Like, no. Like, this is insane that Medicare is not covering these chronic obesity management treatments. But let's keep going. We know treatment of obesity is linked to better medical outcomes, even if bureaucrats haven't figured it out. Eli Lilly. I love you. Eli Lilly cracks me up. Eli Lilly did not comment and respond to CNBC's request for a comment. So I find this fascinating. And so my friends, people have asked me a ton about Medicare. And that's where we're at right now with the CBO, congressional budget offices. Legitimately now, I've gone down the rabbit hole, Alice, and I want to know how that calculation of savings in the first year were only $50 million. There's no way. It's got to be substantially more than that. Substantially more than that. And maybe because it doesn't appear in the first year, I'm trying to remember how much I lost in my first year. Overall, so I've been on GLP-1 medication 22 months, lost 98 pounds. So almost 2 years. God willing, by the time I get to 2 years, I'll have lost at least 100 pounds. And because I'm just still considered overweight right now. I was morbidly obese, then obese. Woo! Celebrate good times, and then now just overweight. So I'm wondering if that's why. We are living in so that, as much as that makes me mad, I feel like I have dragon breath. I was like, eh. I do want to focus in on, we are incredibly blessed to be at this time, to even have access to these medications. If you are in the US, to even have access with compounds, access to these medications, if you, what a gift. What a gift, what a gift, what a gift. And so I need to keep punting back to that this is a huge gift that family members, because we know that chronic obesity management has genetic components to it, that family members of mine did not have this amazing gift, and they died from chronic obesity management, and they didn't have the treatment. And so now having the treatment for it, I am so incredibly grateful and so incredibly appreciative. So let's kick it over to a couple of things. Many of you guys had asked me on my previous video about my eye patches and a couple of other like skincare things with loose skin. And I've talked about them before, but I want to make sure we're hitting them up because we are near holiday season, gift giving season, stocking stuffer season. I know I have my list. I'm checking it twice. I'm the major purchaser for holiday gifts and things like that. And so these are for me. These are for me for the holidays. I believe Hanukkah starts on the same day as Christmas on December 25th, which is so exciting, and happy Hanukkah to my friends who celebrate Hanukkah. But some of you had asked in previous videos about my eye masks. I will link those down in the description link below, as is all of my articles and sources and free encouragement group and free meal plan and all the free stuff I give to the Countess of Shopping community as my gift to you. But if you are shopping holiday gifts, I would love for you to consider using my Amazon shopping list. I do receive a very small commission off of that at no cost to you. But these are on one of my stocking stuffers I'm going to be getting for myself and for other people too. They were on sale last week. I realized my links in my last video where I was talking about these got messed up because I got a new phone. So please forgive me. I got the new Google Pixel, which, by the way, is exceptional. If you do anything, it has 1 terabyte of storage on there, hugely long battery, very much different than my previous Google Pixel. It is awesome. So in the next video that I do, that you guys will see of either what I eat in a day. No, it won't be a what I eat in a day. It'll be a get ready with me. It will be on that new phone, and you can tell me if you like the video quality. These will be on the Amazon shopping list. And then also for loose skin, my absolute favorite is Crepe Erase, but I may be having a new update coming. This is expensive. It's 10 ounces. It's quite a bit actually, but it works. It's one of my favorites. My second favorite as of right now, I have a little secret I'm keeping. So I'm going to keep my little secret, but as of right now, that's my like #1 favorite for loose skin that I love. For neck issues, which, because right here I have it. Full disclosure, I have gotten filler and I do get Botox and I have done lasers. I need to do another laser, I just haven't. told anybody. Can I tell you a secret? Okay, so for our OG people, if you've made it this far in the video, you get to hear my secret, but you cannot tell anybody. We're surprising. You can't tell anybody. Don't tell the Duke. If you know the Duke in real life, do not tell him. We're surprising him by taking him to Disney. So anyways, I can't do lasers on my face because I'm going to be in the Florida sun for a while. Upcoming. And so anyways, I'm so excited. But I digress. So on my neck, the point that I was trying to make is my gobble gobble down here. I am loving, you guys told me, it was viewers who told me, the Go Pure Neck Cream. I'll link that down in the description link below. I am loving it. Loving it. I have several recommendations, but this one has been great. Like, and the price point, that's the other big, that's one of the other big things. For the price point in which it is, this is a fantastic option. And you get a lot, 1.7 ounces. And there's no smell. No smell. I'm like, is there a smell? You guys know I'm like super smeller. When I was pregnant, I could smell if you drank a Dr. Pepper 5 hours before, but I lost those superpowers, but I still do have a very good sense of smell. What does that smell like? There's no smell in it. It smells like lotion, which has no smell. That will be linked on my Amazon shopping list as well. And then also, I've been testing some new protein snacks, so I'll keep you posted on those. But I am loving, loving, loving. Of course, you guys know this video is not sponsored by Bioptimizers, but I love their magnesium. Use the discount code QUEEN. If you're having issues with constipation, not nausea at all, constipation, sleep, and muscle recovery, for me, that is why I take it. And it has 7 types of magnesium in it. The powder format that they have of their magnesium has 8 types in it. I don't like taking, you can mix the powder with water. I prefer to take the pill format. But if you don't like pills, you can take the powder format. I think that's it. Today, on filming day of this, my newsletter came out. If you've not signed up for my free newsletter, it comes out on Mondays and Thursdays. That will be linked down below. You can sign up on my meal plan link, which is free, by the way. People are like, meal plan? I'm like, yeah. Multiple weeks of a meal plan. Totally for you, my gift to you. But fascinating article today about Medicare. Let's keep rocking this. Like, let's not let the news get us down. I feel like that article enraged me and I need to go walk now. I need to go power walk with Mr. Freddy. And we're going to be, I don't know if I've told you, if you've seen the video where I've talked about it, we work heavily with animal fosters, the Count and I, as part of our philanthropic work we do. And so we're going to be fostering a new Great Pyrenees in November. So more to come on her. Mr. Freddy will have a buddy. So I'm very excited. Hopefully, if you saw Instagram this weekend, then you saw our picture. So for Countess of Shopping is my Instagram handle. Okay, my loves, everything will be linked down below. Let's do this. Let's kick booty. And if you haven't joined this week's challenge also in the free Facebook encouragement group, go do it. It's free, and I usually have them where you can win stuff. Be kind to yourself, be kind to others. I'm Countess of Shopping. Count my blessings because life is delicious. I forgot our emoji of the day. It is going to be a tree. You know why? Because you're not a tree and you can move. So tree is going to be our emoji of the day. If you've made it this far in the video, that means that I want to get to know you. So tree is our emoji of the day. And then 2, your accountability question. What are you doing today to move you closer to your goals? Because to me, it's a daily practice. This is the daily thing. If I don't do it daily, I royally make poor choices. So high five on the daily. Love you guys. I look forward to seeing you guys for tomorrow's video. Mwah!